No one has told you this yet, but the signs of prostate cancer are hiding in plain sight. Most men miss them until it's too late. But today, we're exposing the 9 critical signs that could save your life. Trust me, you don't want to miss this. Your health could depend on it. All right, let's get straight to the point. Did you know that prostate cancer is the second leading cause of cancer-related deaths among men in the United States, right after lung cancer? That's right, approximately 1 in 44 men will die from it. The most frightening part: the early stages of prostate cancer often go completely unnoticed because the symptoms are either mild or completely absent. But here's the thing: if you know what to look for, you might just catch it before it's too late. Now, I get it, talking about this stuff isn't exactly fun, but trust me, it's important. If you've been shrugging off those subtle signs, thinking it's probably nothing, it's time to wake up. Today, we're breaking down the 9 warning signs of prostate cancer that you absolutely cannot afford to ignore. We're talking about the kind of information that could save your life. So stick with me until the end, because your health is on the line here. Before we jump in, if you find this information valuable, make sure to hit that like button and subscribe. Let's spread awareness together, because this information could save a life, maybe even yours. And don't forget to share this video with your loved ones. Prostate cancer is a serious issue, and the more people who know the signs, the better our chances of catching it early. Sign 1: difficulty urinating. Let's start with something that might seem like just a minor annoyance: difficulty urinating. Now, imagine as you feel that urge to go, but when you get to the bathroom, it's like your body forgot what it was supposed to do. Nothing happens, or maybe just a little dribble. Frustrating, right? But here's the thing: it's not just annoying, it's a major red flag. This could be one of the first signs that something's wrong with your prostate. According to a study by the American Cancer Society, about 95% of men diagnosed with prostate cancer reported problems with urination as one of their first symptoms. Think about that for a second. That's almost every single man in the study. So if you've noticed that your trips to the bathroom are getting more frequent, but less productive, don't just brush it off as getting older. It might be more than that. Difficulty urinating can manifest in several ways. Maybe you find yourself straining to start, or it feels like you can't fully empty your bladder no matter how long you stand there. Or maybe there's a weak stream, almost like turning on a garden hose and barely getting a trickle. These are all signs that something could be blocking your urethra, the tube that carries urine out of your body, and in many cases, that something could be an enlarged prostate or, worse, a tumor. Has this ever happened to you? Let us know in the comments below. Remember, sharing your experience might help someone else recognize their symptoms early. And if you find this information helpful, be sure to give this video a thumbs up and subscribe for more life-saving tips. Sign 2: incomplete bladder emptying. Moving on to our next sign: ever get the feeling that your bladder isn't fully empty, even after you've just gone? You might chalk it up to age. But here's the truth: this could be a symptom of an enlarged prostate or even a tumor. When the prostate gets larger, it can squeeze the urethra, making it harder for your bladder to empty completely. This leaves behind a residual amount of urine that can cause more frequent trips to the bathroom. It's a bit like pouring water out of a bottle that has a tiny hole in it. It takes forever. And no matter how much you tip it, there's always a little left at the bottom. The same thing happens with your bladder when your prostate is blocking the flow. You'll find yourself going to the bathroom more often, but it never feels like you're fully done. And it gets worse. If the cause is a cancerous growth, you could be dealing with something far more dangerous than just an enlarged prostate. Tumors in the prostate can block the urethra in the same way, but they bring with them the added risk of the cancer spreading if left untreated. Another consequence of incomplete bladder emptying is the risk of urinary tract infections. When urine stays in the bladder for too long, it can become a breeding ground for bacteria. So, not only could you be facing a potentially deadly disease, but you're also increasing your risk of painful infections. It's a lose-lose situation, and that's why this symptom needs to be taken seriously. Sign 3: weak or interrupted urine flow. Next on the list: weak or interrupted urine flow. You might think it's just a part of getting older, but this could be a sign that your prostate is blocking your urethra. When the prostate grows due to cancer, it can put pressure on the urethra, making it hard to maintain a steady stream. Men often downplay these symptoms, thinking it's just something they have to live with. But here's the truth: if your urine stream is weak or stops and starts, it's time to get it checked out. Early detection could save your life. And here's another thing to consider: if your prostate is enlarged due to cancer, the tumor isn't just causing urinary problems. It could also be putting pressure on other nearby organs and tissues, leading to pain and discomfort that we'll talk about shortly. So don't just write this off as a normal part of aging. Get it checked and get it checked early. Let's take things up a notch. Imagine that you go to the bathroom and you notice a pinkish tint in your urine, or worse, you see blood in your semen. Terrifying, right? This is one of the more obvious signs, but surprisingly, it's often dismissed as nothing serious. So blood in your urine or semen can indicate that the cancer has damaged blood vessels in or near the prostate. You see, when prostate cancer starts to grow, it can cause small blood vessels in the prostate to rupture. This can lead to blood mixing with your urine or semen, causing that alarming red or pink color. Now, I'm not saying that every case of blood in your urine is cancer. It could be due to other less serious conditions like an infection. But here's the thing, cancer is a possibility, and it's not one you can afford to ignore. Have you ever experienced something like this? Share your story in the comments. Your experience could be the wake-up call someone else needs to seek medical attention. And if you're finding this information eye-opening, make sure to hit that like button and subscribe for more vital health tips. Sign 5, pain on the back, hips, or pelvis. Let's talk about pain specifically, persistent pain in your back, hips, or pelvis. You might think you just slept wrong or pulled a muscle, but chronic pain in these areas can actually be a sign that prostate cancer has spread to your bones. That's right, the pain you're feeling could be more than just a simple ache. Here's how it works. When prostate cancer metastasizes or spreads, it often moves to the bones. The lower back, hips, and pelvis are common targets because of their proximity to the prostate. The cancer cells invade bone tissue, causing pain that can range from a dull ache to a sharp, stabbing sensation. If this pain persists, especially if it gets worse over time, it's crucial to get checked out. And here's the scary part: by the time the cancer has spread to your bones, it's no longer just in your prostate. This makes treatment more challenging and decreases the chances of a full recovery. So, don't wait until the pain becomes unbearable. If you're experiencing persistent discomfort in these areas, see a doctor as soon as possible. It could mean the difference between catching the cancer early or dealing with it in a much more advanced and dangerous stage. Sign 6, erectile dysfunction. Now here's one that no one really wants to talk about: erectile dysfunction. If you're having trouble getting or maintaining an erection, it could be more than just performance anxiety. The prostate plays a significant role in sexual function, and when there's a tumor growing, it can mess with your ability to perform. Let's get into the details. The prostate is situated just below the bladder and surrounds part of the urethra, the tube that carries urine and semen out of your body. When a tumor develops, it can compress the nerves and blood vessels that are crucial for achieving and maintaining an erection. This makes it difficult, if not impossible, to perform in the bedroom. And here's the kicker: sometimes the treatments for prostate cancer, like surgery or radiation, can also cause erectile dysfunction. So, if you're experiencing this, don't just assume it's stress, get it checked out. Ignoring this symptom could mean allowing a treatable cancer to progress unchecked. It's a tough topic to discuss, but it's a necessary one. Men's health is often neglected, especially when it comes to issues like erectile dysfunction. But being proactive about your health is key to living a long, fulfilling life. So if you're noticing changes in your sexual function, don't be embarrassed, get it checked out. Your life could depend on it. Sign 7, pain during ejaculation. Still on the topic of sexual health, pain during ejaculation. Now, this isn't something that should be happening. If you're feeling pain or discomfort during ejaculation, it could be due to a tumor pressing against your urethra. This pain isn't just inconvenient, it's your body's way of screaming for attention. Let's break it down. The prostate plays a crucial role in producing the fluid that makes up semen. When cancer cells are present, they can cause inflammation or obstruct the flow of semen, leading to pain. It's a bit like trying to force water through a clogged pipe. It's going to cause pressure, and that pressure leads to pain. Sign 8, unexplained weight loss. Losing weight without trying might sound like a dream, but when it happens unexpectedly, it can be a nightmare. Unexplained weight loss can be a sign that your body is fighting something serious, like prostate cancer. The tumor consumes energy, and as the cancer spreads, it can cause a drop in appetite, leading to weight loss. Here's the deal: cancer cells are like little parasites. They feed off your body's resources, consuming calories and energy that you would otherwise use for daily activities. As the cancer grows, it demands more and more energy, leaving you with less. That's why you might start losing weight without changing your diet or exercise routine. What's even more concerning is that when prostate cancer spreads, it can affect other organs, leading to more significant weight loss and further complications. If you're shedding pounds and you're not sure why, it's time to see a doctor. This is especially true if you're losing weight rapidly and haven't changed your lifestyle. Don't assume it's just stress or a good diet, get it checked out. Your body could be trying to tell you something very important. Sign 9. Persistent fatigue. Finally, let's talk about fatigue. We all get tired, but if you're constantly feeling drained, even after a full night's sleep, it could be a sign that your body is struggling with something more serious than just a lack of rest. Fatigue is common in cancer patients because their bodies are working overtime to fight the disease. Here's how it works. Your body is designed to conserve energy when it's under stress, but when you have cancer, that stress is constant. Your immune system is in overdrive, trying to fight off the disease, and this can leave you feeling utterly exhausted. Even if you're getting enough sleep, eating well, and staying hydrated, the fatigue just doesn't go away. But here's the thing, fatigue is a vague symptom, and it's easy to write it off as a side effect of a busy life. However, if it's accompanied by other symptoms like difficulty urinating, pain, or unexplained weight loss, it's time to take it seriously. Fatigue might be your body's way of signaling that something is seriously wrong. If you're feeling constantly tired and it's affecting your quality of life, don't ignore it. Talk to your doctor, especially if you've noticed any of the other symptoms we've discussed today. It could be nothing, but it could also be something serious like prostate cancer. And there you have it, the 9 signs of prostate cancer that could save your life. Remember, early detection is everything. If you've noticed any of these symptoms, don't wait, schedule a checkup as soon as possible. Your health is your most valuable asset, and taking care of it should be your top priority. Prostate cancer is a silent killer, but it doesn't have to be. By paying attention to the signs and taking action early, you can significantly increase your chances of beating it. So stay vigilant, stay informed, and most importantly, stay healthy. If this video helped you in any way, don't forget to hit that like button, subscribe, and share this video with others. You never know who might need to hear this. Let's create a community that supports men's health, because together we can make a difference. Thanks for watching, and until next time, stay safe and take care of yourself.